So friends, I am Dr. Himanshu Kataria. I am Director Arthroscopy and Sports Medicine at Venkateshwar Hospital. I am just here to brief you on a very small issue, something which we are very commonly encountering these days, and that is with the advent of the so-called the political consensus of the establishment to go in for Khelo India, to go in for a fit India. So we realize that the sudden concept in the younger population, the middle age, as well as in the elderly is now to stay fit, which is actually one of the strongest indicators of a strong nation. I mean, if we are looking at a strong nation, we are looking at healthy individuals. And I think with that in mind, sitting here as a person who is specialized in arthroscopy for the last 2 decades, I realized that the sports injuries, which were once upon a time rather unusual, now are coming in a much bigger way, be it a 12-year-old boy who sustained an injury to his ligament, or be it a 70 or a 50, 65-year-old male or a female who is trying to play badminton to stay fit. In all these cases, we find that there are varying kinds of injuries which at a couple of years back were simply disposed of as that this is a small injury. This doesn't just, we used to get an X-ray done, we used to simply label it as soft tissue injury, and that's the end of it. Give them some medication, ice packs. Most of the time, such patients used to end up in chronicity, used to end up, if it was something involving the shoulder, used to ultimately end up in a frozen shoulder or in stiff knees or in stiff elbows and stiff ankles. But now with the advent of newer technologies, particularly with the advent of arthroscopy, with the advent of the newer technologies in the form of high resolution MRIs like the 3 Tesla MRIs, we are able to diagnose with much more precision these injuries, and we are able to intervene at a much earlier stage before permanent damage takes place. Now, I would definitely like to emphasize that one must try to understand that these sports injuries are slightly different from routine fractures. Fractures are something where we actually, when you try and plate them, you try to nail them, most of the time, most fractures tend to heal. Unlike sports injuries, which do not heal on their own. Most of the sports injuries, if they are leading to complete disruptions of the soft tissues or of the ligaments, would invariably require some kind of a surgical expertise, some kind of a surgical intervention. And these days, it is with the advent of arthroscope that these injuries can be managed. And since the department per se has an extensive rehabilitation protocol, most of the sports injuries require a different and a specialized kind of a rehabilitation protocol, which not all centers provide. And I'm fortunate to be in a center where we are able to provide all these facilities. So friends, do take these things into consideration. Whenever you have injuries, do approach the right person. Thank you.